Hello everybody, my name is Dr. Eric Krieger. I'm a physical therapist at Viverant in Chanhassen. I'm also here with Dr. Lucian Panait with Body GI Surgical Consultants. We're here with you today to talk about some of our awesome and unique partnerships we're developing with Diastasis recti as well as hernia repair. I'm going to let Dr. Lucian introduce himself as well.
Hi, I'm Lucian Panait. I'm a general surgeon and I'm specialized in hernia repair, and I'm very happy to partner with Dr. Kruger and Viverant in taking care of our patients.
Awesome, thank you so much. So I wanted to bring everyone in today to talk about both diastasis and hernia. And the big push in physical therapy is both preoperative care and postoperative care. Reaching out to Dr. Panait, that has been one of the biggest searches for surgical consultants. And it's also a very misunderstood concept in physical therapy. The beautiful part about this is we've been finding great outcomes in preoperative care for hernia repair and also helping speed up the post-surgical process. When it comes to diastasis, as I learned from Dr. Panait, is that's usually not fixed surgically, so having the advice and the guidance of a physical therapist can be amazing for helping improve some of the outcomes that you're experiencing. I want to turn it over to Dr. Panait to talk about the middle portion, which is when and why we should have surgery versus when and why we should have conservative-based care.
Yes, thank you. So diastasis is different from hernias. A hernia is a hole in the muscle, while the diastasis is a weakening of the muscle. A lot of times diastasis happens after pregnancy, and other times it happens with weight gain or some physical activities that lead to supranormal increases in the abdominal pressure. In any case, in the vast majority of the cases, the diastasis can be treated conservatively, and this is our approach, and that's what we recommend for our patients. We think that the partnership with the physical therapy group can lead to best results, and only patients who attempt to do physical therapy for a few months and do not obtain the adequate results may be evaluated for a surgical intervention. And there are different types of approaches for surgical repairs of diastasis, ranging from open operations, which are typically done by plastic surgeons, to minimally invasive approaches like robotic surgery, which has been employed for these purposes in the last few years and has been proved to be successful. But like I said, surgery is usually not the first resort, it's the last resort. With regards to hernias, a lot of patients come to our practice to get a hernia repair, but the surgical part, it's a small part of the continuum of care. We believe in rehabilitation, getting patients in the best possible shape for surgery, both nutritionally and from the physical shape standpoint, and very importantly, post habilitation or rehabilitation after surgery to help them regain the abdominal function and to be in the best shape possible.
Okay. And I love that approach. I think that's where we can come in as post-operative care professionals to work with Dr. Panait. I think the big misconception is after surgery, am I going to be able to get back to things that I want to do? And speaking with Dr. Panait, and from my perspective, we get back to the things they want to do. Whether that's daily life activities, but also those things that are running or weight training activities. But then we can work as a care team, both with Dr. Panait and myself, to help you decide when can we get back to things like running, when can we get back to things like lifting, and doing it in a way that's going to optimally improve core strength, hip strength, lower back strength, to help decrease the risk of reoccurrence of said hernia or diastasis. And that's where we can communicate as healthcare professionals, as well as include the patient, to design that care plan for that patient that fits their needs, wants, and goals.
It is interesting because this is our motto at the Minnesota Hernia Center: do what you love, love what you do.
Yeah.
This is our mission.
Yeah, and that's the biggest thing we do at Viverant is we're going to get back movement and get back the movement that we want to do. And I think that's the big thing that we're trying to do with patients is empower them because they're super capable, super resilient. We're just helping plant the seeds to help them kind of grow and do the things that they want to do. Do you feel like there's any other big things that patients should know in regards to when should I seek out physical therapy first, or when should I seek out a consult with you on that side of things?
I don't think it matters. I'm happy to see everybody, and I never rush to the operating room. Yeah. I think it's very important to, from the surgical standpoint, when you decide on an operation, to determine what are the patient's goals? Why are they seeking surgical care? There is not a recipe that applies to everybody. I think you have to tailor this to the individual needs, the patient's age, the associated medical problems, and their physical ability and physical shape they are in. Whether they see me first or they see the physical therapist first, I think in the end they will still get the same care here.
And I think that's a beautiful approach. The one thing I always like to throw in is where I think I can be of service too is the cool thing with physical therapy that's evolving is we're needing a more of a direct access approach. So patients actually can come off the street and see us. And that's what I always like to tell patients is even if we feel like you need to consult with Dr. Panait, I can do that or any of the physical therapist environments and also send them your way as well. So that's the cool part is we're trying to decrease that cost of care for patients as well and kind of get them to where they need to go quicker. And I think that's kind of the big partnership that can help as well.
I agree.
Awesome. Well, thank you guys. Again, my name was Dr. Eric Krieger.
Dr. Panait.
Have a great day.